Fibroblast growth factor 21, also known as FGF21, impacts the health and/or function of many organs and tissues. But what about longevity? So FGF21 overexpression, so animals that are engineered to have more systemic levels of FGF21 have a longer lifespan. So first, before looking at that, how much higher was FGF21 in these transgenic mice? So whether comparing the fed or fasted state, we can see that the animals that were engineered to have more systemic levels of FGF21 had 5 to 10-fold higher levels when compared with animals, normal animals, wild type, WT. All right, so lifespan data. So here we're looking at lifespan data in C57 black 6J mice, and that's the genetic background. And that's important because I'm going to compare the lifespan extending effect of FGF21 versus other interventions in mice. And those interventions in mice are going to be in these C57 black 6J mice, so they're all performed on the same genetic background, and only the intervention is different. All right, so first, starting with the data on the left, we're looking at survival. So the black line is average survival, the proportion where half the animals are dead and half are still alive. And we can see that FGF21 overexpression in the male mice significantly extended average lifespan, but not maximal lifespan, as we can see both the controls, the wild type, and the FGF21 transgenic mice live to about 42 months. So in terms of the average lifespan extending effect, the controls live 28 months, whereas the FGF21 overexpressing mice live 36 months, a significant increase in lifespan. What about the data in females? So again, starting with the average survival, right at the 50% survival mark, we can see that the FGF21 overexpression in the female mice extended both average and also maximal lifespan. And interestingly, they stopped the experiment when the animals got to 43 months. So it's unknown how much beyond 43 months that these female overexpressing FGF21 mice would have lived. So in terms of the average lifespan increase, the controls live 30 months on average, and the FGF21 overexpressing mice, TG, live 40 months. So a 10-month extension, about a 30% increase in average lifespan. So these are pretty big, pretty large effects. How does the FGF21 mediated lifespan extension compare against other interventions? So I'm going to show two that have been popularized because they were recently published: Alpha-Ketoglutarate and Berberine. So first, starting with alpha-ketoglutarate supplementation, this is based on data that was published last year. And also notice this data, again, as I mentioned, is in C57 black 6J mice. So same genetic background, different intervention, whether it's FGF21 overexpression or alpha-ketoglutarate supplementation. So starting with the data on the left, this is pooled data from two studies, and we can see based on the p-value that alpha-ketoglutarate supplementation significantly extended both average and maximal lifespan. But note that all of the mice were dead at 37 months. So how does that compare against the FGF21 transgenic mice? So whereas the alpha-ketoglutarate supplemented mice lived 31 months, FGF21 overexpressing mice live 40 months. Again, that's like a 30% increase when compared with alpha-ketoglutarate. And then in terms of maximal lifespan, we can see that the FGF21 overexpressing mice, and again, this is the data in females, lived at least 43 months, where the alpha-ketoglutarate supplemented female mice lived 38 months. So once again, FGF21 overexpression seems to be a better intervention for extending lifespan than alpha-ketoglutarate. Now in the males, we can see that the p-value for lifespan extension was not significantly different versus the wild type, versus the non-supplemented controls. So nonetheless, let's have a quick look at the comparison for the alpha-ketoglutarate supplemented male mice versus FGF21 overexpressing male mice. And we can see that the alpha-ketoglutarate supplemented male mice lived an average of 31 months, whereas the FGF21 transgenic mice lived 36 months. So from this, we can conclude that FGF21 overexpression increases lifespan more than alpha-ketoglutarate supplemented mice. So how does the lifespan extension in FGF21 mice compare against Berberine? And the reason I've highlighted these two studies is because they were just recently published. I don't have time to go through all of the lifespan extension, the studies that have looked at lifespan extension, but I just wanted to cover a few. So once again, notice that these data for Berberine supplementation is in C57 black 6J mice. So again, same genetic background. The only thing that's different for comparing FGF21 transgenic mice with the alpha-ketoglutarate and the Berberine supplementation is the intervention, but the genetic background is the same. So based on this data, we can see that the average lifespan in berberine supplemented mice was increased when compared with non-berberine supplemented mice, and also maximal lifespan was increased by a small amount. But notice that the duration that the mice lived in both the berberine and the wild type study is that none of these mice lived past 26 months. So in contrast, FGF21 transgenic mice live much longer than berberine supplemented mice. So just to have a look at the numbers, and notice that in this study, they didn't report data for females, they only reported data for male mice that were supplemented with berberine. So we can see that berberine supplemented mice lived on average 23 months, whereas the FGF21 mice lived 36 months. And all of the FGF21 transgenic mice, they had a maximal lifespan of 42 months, whereas none of the male mice in this study, whether controls or berberine supplemented, lived past 25, 26 months. So from this data, we can see that FGF21 transgenic mice seems to be a better strategy when compared to extend lifespan when compared to alpha-keto-glutarate or berberine supplementation. So with this in mind, and with this strong lifespan extending effect of FGF21 overexpression, the next question is, how does FGF21 compare against the gold standard for lifespan extension in mice, CR, calorie restriction? And let's have a look at that data. So here we have survival data, and again, this is in the same genetic background, C57 black 6J mice. And we've got data for ad lib, so the animals ate as much as they wanted, 20% CR, so that's the blue line, and then 40% CR. So 40% CR didn't extend lifespan in this study, so I'm not going to talk about it. I'm just going to talk about the data comparing the ad lib mice versus the 20% CR mice. And looking at average survival, we can clearly see that both average survival and maximum lifespan are both extended by 20% calorie restriction. And that's what the numbers look like there. So the controls lived an average of 25 and 33 months for average and maximal lifespan, whereas 20% CR, that was 36 and 45 months. So how does this data in the female mice for 20% CR compare against FGF21 transgenic mice? Whereas the female 20% calorie-restricted mice lived an average of 36 months, FGF21 transgenic mice lived 40 months. And then in terms of maximal lifespan, whereas the 20% CR mice live 45 months, it's hard to make the comparison here because the FGF21 overexpressing female mice, that experiment was stopped at 43 months. So they lived at least 43 months. So they're somewhere in the ballpark of the calorie restriction of 45 months for maximum lifespan. So male mice that were exposed to 20% CR, that's what we can see here. And they have an average, increased average and maximal lifespan as indicated by the vertical lines and the arrows. So in terms of the numbers, the controls not on CR lived 26 and 36 months for average and maximal lifespan, but male mice that were on 20% CR, 33 and 42 months. Obviously significant increases for both average and maximal lifespan. So to compare that against the males that were FGF21 overexpressing, we can see that their average lifespan was 36 months, which is higher than the 20% CR where they only lived 33 months. And then the FGF21 overexpressing male mice also had similar maximum lifespan to the 20% CR mice, which was 42 months. So based on this data, it looks like there's a higher average lifespan for FGF overexpressing TG transgenic female and male mice when compared with CR. So it's a pretty good intervention, it seems, for extending lifespan. So with this in mind, how can FGF21 expression be increased in people? And there are a variety of studies that have investigated this, including starvation and fasting. So these are all interventions that increase FGF21 levels in people. Eating a low methionine containing diet, so methionine restriction, and eating a low protein diet have also been shown to increase FGF21 levels. A high-fat ketogenic diet increases it, and also exercise. Now, while picking one of these interventions is relatively easy, however, the story gets more complicated because there are situations such as obesity and aging that also increases. So first, in terms of the obesity story, here we can see circulating FGF levels on the x-axis plotted against BMI on the y-axis. And this is data in healthy controls, HC, and in type 2 diabetics, T2D. And we can clearly see that there's as BMI increases, there's a positive correlation. And FGF1 levels correspondingly increase. So higher BMI is correlated with a higher systemic level of FGF21. And as I mentioned, aging also increases FGF21. So that's what we can see here. So the log of circulating FGF21 levels on the y-axis, and then plotted against people who are younger than 40 years old, and relatively older, older than 70 years old. And we can see that the older adults had about a twofold higher systemic level, circulating level of FGF21. So then that raises the question, how can we tell if having higher levels of FGF21 during aging is good or bad for health? So before we get to that, this was a relatively small study in terms of the aging effect. Let's have a look at a little bit a bigger study that included a wider age range. And that's what we can see here. So in this study, they looked at FGF levels starting with children as young as 5 years old and all the way up to people who are 80 years old. And what we can see is a clear increase in circulating FGF21 levels from 156 to about double, 358.5. So again, how can we tell if having higher levels of FGF21 during aging is good or bad for longevity? So to get at that question, we can derive some insight from Centenarian offspring. So the kids of people who live longer than 100 years old. So first, Centenarian offspring have a generally better health than age-matched people that are not kids of centenarians. And one way to, in support of that hypothesis, we can look at all-cause mortality risk. So when looking at the all-cause mortality risk for centenarians' offspring versus controls, which is what's plotted here, when looking at the odds ratio for all-cause mortality or even deaths related to cancer or cardiovascular disease, we can see significantly lower risk for all-cause mortality, cancer, and cardiovascular disease in centenarians' offspring when compared with controls. So just looking at the odds ratio, we can see a 62% decreases for 62%, 71%, and 85% for total mortality, cancer, and cardiovascular disease-related mortality in centenarians' offspring versus controls. So what about FGF21 in centenarian offspring? So that's what's shown here. FGF21 plotted on the y-axis as found in different groups. So OFF is centenarian offspring, HC, healthy controls, T2D and C is type 2 diabetic patients without complications. T2DC are type 2 diabetic patients with complications. So they had complications that are commonly associated with type 2 diabetes, like kidney disease, eye disease, nerve problems, etc. And then AD, Alzheimer's disease patients. And what we can see is that the offspring of centenarians had significantly higher levels of circulating levels of FGF21 versus all of these groups. So that would suggest that it's a pro-longevity hormone as the animal data. So how can we gain more insight into whether having higher levels of FGF21 during aging would be good or bad for health? So also in the centenarian offspring, when comparing the centenarian offspring versus their partners who did not have parents that were centenarians, we can see that the centenarian offspring also have significantly lower levels of fasting glucose and fasting insulin. Now this is important because FGF21 transgenic mice, so the mice that were engineered to have more circulating and systemic levels of FGF21, this pattern is also found in the old FGF21 overexpressing mice, both in the male and the female mice. So when looking at that data, starting at the male mice, we can see that the insulin levels in the old FGF21 overexpressing transgenic mice are about half of what the non-FGF21 overexpressing mice have. And then there's a significant reduction in glucose too in these FGF21 overexpressing mice. So what about in the female animals? So insulin levels were close to statistical significance. You can see that p-value is 0.08, and the insulin levels were about half in the FGF transgenic female mice when compared with the wild-type mice. But the glucose levels in the FGF21 overexpressing mice were significantly lower when compared with the normal levels of FGF21. So when considering all of these data, it would seem that having high FGF21 levels when combined with relatively lower glucose and insulin may be a pro-longevity strategy. All right, that's all I've got for now. I hope you enjoyed the video and have a great day.